So I think the spirit of that question is, how are they different in terms of how they appear clinically? And they share some common features. The main feature is the exudation, or the leaky blood vessels. So in both fever and in Coast disease, the blood vessels are not normal. And by that, I mean normal retinal blood vessels behave kind of like a hose. Fluid comes in one side and comes out the other side and doesn't leak, along the length of the hose. And in both fever and Coast disease, a common feature is that the hose is leaky. It's kind of like the sort of hose you put into a flower bed, like a soaker hose. And so consequently, there are some of the components of blood, usually what we call the non-cellular components, meaning not the red cells and the white cells generally, that will seep out of these very small openings in the blood vessel's wall and accumulate underneath the retina. And that's the E in fever. That's the exudative part, exuding meaning leakage. Sometimes you'll get blood as well, but more commonly it's the non-cellular part of blood that leaks underneath the retina. So that's one way that they're similar. That aside, there are a number of differences that make it fairly straightforward to diagnose the two. First of all, Coast disease is purely a vascular disease and doesn't have proliferation or growth of abnormal blood vessels that are part of the clinical picture. So in fever, by contrast, not only are the blood vessels leaky, but you will also get growth of abnormal blood vessels that grow off of the surface of the retina up into the vitreous gel. And then those blood vessels, when they, the scar tissue that grows within those, that proliferation has something of a life history. Scar tissue always thinks it's healing a wound. So once these abnormal blood vessels with the scar tissue grow off the surface of the retina, the scar tissue will contract. And when it contracts, it detaches the retina into a tractional retinal detachment. So Coates doesn't have that, what we call proliferative or blood vessel and scar tissue growth component. The other feature probably I think that is helps distinguish the two is that in Coast disease, the blood vessels have a very characteristic dilation, so that they look like they have beads really along the length of the blood vessel. These little localized dilations, we call them micro or macro aneurysms, depending on how small they are. That's a feature that's very unique to Coast disease, and we don't typically see that in fever. Just looking at an eye alone, those are some of the distinguishing aspects of it. If you add then the fact that Coast disease is not a heritable condition, we don't really understand the genetics of it yet. We know that it occurs unilaterally, generally in young males, so that whereas in fever, not uncommonly, if we look at parents and siblings, particularly doing an angiogram, we can often identify an affected parent or sibling, generally mildly affected, and they didn't know that they had it, but clearly they do. So there are ocular features and also sort of heritability features that distinguish fever from Coast disease. Dr. Drenser, do you want to add anything to that?
I think that's terrific. I think that it's an important thing to recognize the difference of the genetics as well. There are occasionally some reports that will say Coates, is that they found a genetic link. Those are really unverified reports, and I truthfully do not feel that it may be genetic within the eye itself, what they call tissue mosaicism, but it's not a systemic, meaning that every chromosome is affected. And I think that's a big difference as well from a standpoint of understanding the disease, but also for subsequent treatments. So, when we were talking about fever and gene therapies and potential alterations, that's probably not going to be in the pipeline for Coates disease.